Of all the sciatic nerve techniques that I use, this is my favorite. And this is one that I accidentally came up with in class one day, and I use it every session for people who have Piriformis Syndrome. I've already cleared out the back. I've done all this other stuff. They're still having symptoms. I finish each session with this. Why I don't do it the typical way on the client on their back is because this is easier. You don't have to lift the heavy leg. Here's the setup for this technique. I'm going to come in and grasp the leg here so I can control the foot with my right hand into dorsiflexion. Remember that there are two branches of the sciatic nerve that come down and they split in the popliteal space. Tibial nerve is twice as big as the peroneal nerve. The tibial nerve comes straight down. It can imitate plantar fasciitis. The peroneal nerve comes around the ankle and comes down here, and it can imitate different kinds of foot problems, including ankle sprains. So we got to mobilize both of them. What I'm going to do is I'm going to control the knee right here, and I'm going to ask you to flex your chin all the way toward the chest. That pulls the nerves, spinal cord nerves, nerve roots, her direction. And then when she comes back, I'm going to step in like this to stretch the tibial nerve. Right now we're flossing the nerve. She's pulling the nerve her way. Now I'm pulling the nerve my way. Notice how I'm not having to lift a heavy leg. This is really a wonderful technique. Come on back in. Eventually you're going to be able to straighten this knee completely over a series of sessions, or sometimes it's just a couple of sessions that you're able to get that kink out. We don't know where it's kinking. That's the thing with this. What's beautiful about nerve flossing is that you don't have to worry about where it's kinking. It can be kinking in the low back, even sometimes a disc problem. You can free it from a disc problem. Piriformis, some of that stuff in the butt, you can free it from that. Okay, so that's the tibial nerve. What if we want to do peroneal? What do we do? What do we have to do different? Well, since it's coming around the lateral part of the ankle, we're going to want to turn the ankle like that, right, to put more of a stretch on it. So that's inversion and supination. We're going to want to bring it like that. Whatever position we can do to put the most stretch on that is what we do. So this is how I'm going to position it. And then I'm going to dorsiflex. Those are the positions right there. So that's isolating the peroneal branch. We're going to do the same thing, head forward, and just work out their tolerance barrier. Do not bulldoze a barrier when you're doing nerve work. It'll set off reflex spasm. That's going to be hard to get rid of. So always keep in communication with your client. And about 10, 15, 20 reps the most each time. After a series of sessions, you get to a point where you want to just hydrate that nerve. To hydrate the nerve, we're going to tension it. To tension it, she's going to pull the nerve bank her way, and I'm going to come in at the same time. So now we're pulling it at both ends, right? We're stretching it at both ends. That's stretching that nerve, and when we come out, it's sucking in all those fluids, helping axoplasmic flow of nutrients back into the nerves. Here's how it goes. Let's go. Slowly, first I'm doing tibial. Notice the foot's just back in tibial, straight up and down. And now we're going into peroneal with dorsiflexion. And you can go a little bit quicker with this tensioning because right now that nerve is pretty healthy. You don't start doing tensioning until they already are feeling fairly pain-free. You just want to make that nerve healthy and happy.